Hi, I'm Liz and I'm working on health inequalities and for ethnic minority people in Somerset, and today we're talking to Denis and Ben about access to mental health services in Somerset. So have a look at the podcast and hope it helps you. Denis.
Hi, I'm Denis Kigongo Victor. I'm a counselling psychotherapist based here in beautiful Taunton, and I'm honoured to be part of this great work, so do check out the podcast.
My name is Liz and I'm working on the health inequalities project, which is looking at ethnic minority people living in Somerset and their access and experiences of around mental health and sexual health and domestic violence and access to services in general, health services in general, particularly vaccines, but not just COVID, obviously. I'm here this morning with Denis and Ben. We're going to talk about mental health in Somerset and how it works. So Ben, would you like to talk a little bit about what you've been doing?
Yeah, sure. So I've been involved with 3 other young diverse people into a project that's called Diverse Young Somerset, and we surveyed other young diverse people around Somerset, our age, so ages between 13 and 18, and we questioned them about quality of mental health services and support, discrimination in and general quality of education, all sort of within the area of education and curriculum. So we had our findings published in a report, and we want to get that out to as many people as possible in order to try and make a change of some sort. So.
That's amazing. Wonderful. We'll talk a bit more about that in a moment, but Denis, how come you're in Somerset?
Well, long story. I've been in Somerset about 10 years now.
Good.
But I came to Somerset from Devon, where I'd been for probably 8 or so years. Before that, I came from Uganda. Mm-hmm. Yeah, I came to England because I got a scholarship to come and train as a youth worker. So I qualified, then did several years of youth work in Devon. And then when the funding ran out, I got a job in Taunton. So I came and did that for several years, and then decided to go back to university and retrain to be a therapist. That's the long story short.
That's very interesting. I'll talk to you more later. So what's the work you're doing now as a therapist? What sort of?
I'm now a counselling psychotherapist. So I run a private practice called Therapy, but I also work part-time for a private boarding school here in Taunton. Yes, I do part-time hours there, and then the other half of the time I work in my private practice.
So what sort of therapy do you offer?
My training is integrative, so I basically support really anybody that comes my way. So I'm trained to be able to employ different schools like CBT, the person-centered approaches, psychodynamic work. So yeah, I can work with pretty much anybody that comes to see me.
That's amazing.
Mm-hmm.
So when you, what sort of mental health issues arises when you're meeting people? What are the most common ones?
The most common ones are stress related. There's a lot of stress. Then there's depression. That's another common one. And amongst the young people, there is a lot of anxiety related issues, and then then the panic attacks and anxiety, stuff to do with self-harming and a lot of suicide and things like that. Yeah. So they vary. The difficulties vary. Excuse me. They vary depending on age, the issues you find amongst young people will be different from the struggles that you find amongst adults. Yeah.
So has that changed through COVID and all the lockdown and everything?
I think COVID and lockdowns made it worse. Because, as human beings, we're naturally made to connect. We need to connect with other people. So the isolation created a lot of struggles, mentally, physically, financial issues, which also then trickle into mental, struggles. So the lockdown didn't help at all. People felt very, very isolated and alone. And there's a general fear. There's a lot of people have been supporting who are scared because, they're generally scared about health and health-related issues. And also accessing support and, so it's been complicated.
As hopefully we're coming out of COVID lockdowns and all the stuff that went with that. How do you think that's going to affect people's mental health now?
I think the reopening gives a bit, more hope because there's more access. People can access support. They can, visit friends or relatives, or they can go out instead of being stuck in the house. And people spend all their time in their head processing and thinking through stuff. They can go out, they can do things. So I think, it's hopeful that things will get better as we go along.
Yeah, and hopefully meet people instead of all on Zoom and things.
Exactly.
So what sort of difference does your intervention make to people's lives, would you say?
It's difficult to measure sometimes, but I think just having somebody that people can come to talk to about any struggle without fear of judgment, because my job is to support regardless. I don't judge anybody. I'm there to support and create a space where they'll feel free to talk about anything, even awkward situations or stuff that they wouldn't speak to their family about or their teacher. So having a space that's confidential. Our relationship with the people I support starts in the therapy room and ends in the therapy room. So, they're safe to bring anything. So having somebody to speak to, but also being able to signpost, like people who come to me with issues that I can't support, being able to give them advice and show them where, they find specific targeted support for their individual situations. I think that's mainly what I do, is hold people really.
Yeah, that's important, really important. Do you find that there's difference in access to mental health services if you're coming from a ethnic minority background?
There is. See, I can't speak for all the ethnic minority groups, but there are some general common, characteristics of all the groups. Access is difficult, but also some of it is cultural, especially for Black and African and probably Caribbean backgrounds. We don't talk about our stuff with anyone else. Stuff is dealt with within the structure that we have within our families or our clans or our tribes. So we don't talk about our stuff with other people. So people quite often will hold on to very painful situations, traumas or abusive situations or general struggles, but they will not speak to anyone else because you don't do that in our culture. So it's very difficult to get people to come out and seek help. But also, some people struggle to find people that they will identify with culturally because they think therapists who are from maybe, particularly for the Black people, they think therapists who are from the white backgrounds may not understand them, which is not true actually, because we're all trained the same. We're all trained and prepared to support whoever walks through our doors. But there's those kind of fears that people may not understand my issues or may not understand my background, or so that holds people back. The other thing is therapy and mental health support is expensive. It's quite expensive for a lot of people. So financially, people just can't afford. Most minority communities cannot afford paying a therapist £40, £45, £50 an hour to get regular support. And then also the isolation was ethnic minority groups that live, especially in places like Somerset. Most of them are here to work, so they spend a lot of their day, nights working. So finding the time to access support is difficult because they work in the nights, most of them, and then in the daytime they'll be sleeping. So there's not very much space to reach out and seek. And some people just don't know where to look because the NHS is overwhelmed and so. So
I know you're a private practice, but if somebody goes to the doctor or if they have to go to A&E in an emergency, would they be able to access healthcare, mental health care through that, or is it are they treated equally? The sort of therapies that are offered, is that the same if you're coming from different backgrounds or?
It is the same. It is the same. It's just that therapy and mental health support provided through the NHS is targeted and is also quite often limited to a specific time, maybe 6 weeks or so. Some cases may need long term. Some people need 2 years, 3, 4, 5 years support. So 6 weeks is mainly around CBT. Just they're given basics to manage through their situations. That sometimes may not get them through, but the support is there, and but I said there's a long waiting list.
Yes.
Yeah, that's the only issue. But the quality of support that people be given is the same. There's also quite a lot of support that's available online. There's several charities and organizations and agencies that provide help, some anonymously. But a lot of people don't know about it, so it takes time to look on the internet. There's a lot of free stuff and people who are ready to support without having to pay out loads of money.
Now, one of the things I need to do is to make sure that people have access to that information. So we'll be working on that.
Yeah.
So what do you hope for the future?
But I hope for the future generally, or
oh well, generally yes, but specifically for mental health services.
I'm hoping that it looks like the future is bright. There's people are talking a lot about mental health at the moment. It was difficult in the past, and there's a stigma about it. Still is a stigma. That's why the way we work under very strict confidentiality guidelines. That's why I said my relationship starts in the therapy room and ends there. Because some people don't want to be seen to see a therapist. Because people still think, therapists, counsellors, and now they read your mind and they do all this, which is not true. And some people think you go to see a counsellor if you're falling apart. You're really in a bad way, you're going crazy. So there's a stigma still. I'm hoping that will die out and people understand that therapy is just support. Like if you fell and broke your ankle, or you broke your arm, you go to doctors, you get plaster, you get a bandage, you get whatever you need. That's physical difficulty. Mental health is mental difficulty. We have the physical part of us and the mental part of us. Both need the same support, but for some reason it's okay to break your leg and go and see a doctor, but then you can't go to see a therapist when you have a sleeping disorder or whatever. So I'm hoping that the stigma will die out. I'm hoping there will be more access to support for people, because people do struggle. There's a lot of people struggling out there and they don't know where to go. So I'm hoping there will be more provision for that, and more agencies will come up to support. That's all I can hope for.
That's a lot to hope, I think.
Yeah.
Ben, how, from your research, does that fit with what you've discovered?
Yeah, definitely. So again, we interviewed, surveyed over 70 diverse young people around Somerset, and nearly 70% of them mentioned some form of racial discrimination in school, and 67% of them reported feeling problems such as depression or anxiety. So yeah, I think our findings definitely support that. In terms of support as well, I think in school in particular it is very limited, and I think it is definitely difficult for people from diverse backgrounds to access support. I think a finding here we have is ethnically diverse young people are twice as likely to be referred to mental health services through social care rather than primary care. So I think in those situations, for them to even get that help, it would have to be a breaking point rather than sort of having that support at a time where it was maybe preventable. So, it could be a stigma, it could be lack of financial situation. It could be general stigma around their parents as well. Like you said, culturally, they could feel like they can't really talk about it openly with their parents. I think it could be also religious. I think a lot of these people come from maybe more stricter religious backgrounds, maybe different sort of environment than we have here. I think our school environment is quite a bit more secular and I think a bit more open about discussion. I think our findings definitely do sort of inform that, and we can definitely use it to hopefully try and inform other people and maybe motivate change.
So we've got to change. We've got to get better at this.
Absolutely.
And lastly, really, do you have a message for minority ethnic people living in Somerset?
The message is, there's quite a lot of us actually in Somerset. We just need to come out and embrace the available opportunities. Like you guys here are doing a great job, mobilizing and getting communities together. Support is available if people will, reach out. Instead of hiding in the houses and feeling isolated and alone, I just encourage people to come out and speak about your struggles. There's somebody out here that's willing to help. If you'll be brave to step out, it's not as bad as it sounds. It's just a matter of reaching out. You'll be surprised how much support there is out here. So I think that's what I would,
That's good. Don't be alone.
Don't be alone. Don't be alone. Don't be scared. Try and reach out. And also, if you can't find the structured support, speak to someone. Speak to your relative. Speak to a friend. Speak to your employer. Speak to a colleague. It's no point struggling alone. Talk to somebody. If they can't give you expert support, they will be able to signpost, show you where to go, but don't struggle and suffer alone. Whether it's depression, anxiety, or just fear, or you're in a new environment, just terrified, or whether it's racism or relationship breakdown or some taboo subjects like we don't talk about culturally, things like cultural practices are being carried over. There's so many challenges that people struggle with, but speak to somebody. The other thing is, quite often people run towards ending life and committing suicide. It's not the solution. There is help out there, so be brave and reach out.
Thank you both very, very much.
Thank you.
We appreciate it.
Thank you.
Thank you.